The particular need for My Desktop is to provide access to the computer systems that all the clinicians and healthcare professionals use across the trust. The problem was if a clinician went up to a computer, logged into a computer system, walked away from that computer system, somebody else would use that computer system, log their system out. Whenever they come back, they had to re-log in again. And that's just wasting time, and time's a precious thing in healthcare.
What we have now is a system whereby we have a simple pulley system where our identification cards are marked, and we can come up to any computer within the department and simply swipe our card. This enables us then to access all of the IT systems that we have. That information that we have open on the computer that we have in one part of the department will then follow us to another part of the department, so that when we move to another geographically separate part of the department, we can once again swipe in and all of our information comes up immediately.
We decided to be quite ruthless and go for really trying to force the users to use the product. So we removed about 75% of the PCs and replaced them right away with the little Xero client, and that meant then that users had no choice really. They had to get in and make sure that they had access. By the end of the third week, we had 75% of all staff trained. Very, very quickly staff could see the benefits, and they wanted that swipe card because they knew if they didn't have it, it was going to slow everything up for them and obviously ultimately for the patient.
That it takes away some of the barriers to us accessing patient safety. So we are able to have the documents that we need open at all times, and therefore, even considering human factors, people are more likely to look up old records, blood tests, x-rays are more available, so the patient gets a more complete package of care done in a much more quicker time frame, with decisions made in a much safer environment for them. I would say on average it's taking 3 to 5 minutes off each patient encounter for us, and certainly has also helped us with our poor memory problems where we can never remember our passwords. So all of these things have come together to create a fantastic opportunity for us to help improve patient care.
This particular installation was within the emergency department, but this is equally usable across all of the healthcare professionals. In fact, we're now rolling it out to the community staff, so across the community piece, so staff can get access to the same systems that they would use back at the acute hospital, but in a patient's home, sitting outside the patient's house. You know, it's the immediate access to data is going to be key here.